the native medicine wheel with its 4 quadrants of mind and body and emotions and spirit. And they say that for health, you have to have a balance between those 4 quadrants. And traditional shamanic medicinal practices, Ayurvedic medicine of India, the G medicine of China, all the medicine men and women of traditional cultures have always assumed and known about the mind-body unity. They just didn't have the science, but they knew it. Now we have the science, but we no longer know it. Turns out that it's not even that these separate systems are connected together, they're not even separate systems. They're one system with different manifestations. I mean, think about it. First of all, evolution begins with a single-celled organism. That cell then differentiates and becomes a multi-celled organism. But the basic functions of defense, nourishment, and survival have to be carried on by the organism. The average medical student, until very recently, has never even heard the word trauma in their education. It doesn't show up. We don't talk about it. We don't talk about its impact on the brain, on the personality, on the emotional life of people, on its impact on people's physical health. It's not a word that we mention. We're traumaphobic. As a fellow doctor said to me, the medical profession is traumaphobic. Psychiatrists these days are trained mostly in this biological model of psychiatry where everything comes down to a biological brain disease. Here, let's give you a pill. The last thing most psychiatrists know how to talk about is actually emotional pain or its origins in human experience. You'd think they'd know how to do that, but they don't. They're not trained in it. It's not part of the predominant medical ideology. And, you know, as a physician, I can tell you, we like to think of medicals as a science, and it has certainly great scientific achievements to its credit and great scientific insights to buttress its successes. But it's as much as ideology as a science. And ideology has certain hidden assumptions that are hidden from the people that believe in ideology. And so that if something is excluded by your ideology, you just won't see it. And so that you can be talking to somebody about your addiction, and the simple question, what did they do for you? And how come you're in so much emotional pain? Doesn't occur to anybody, you know, trained in the classical manner. Now, this is true not just for physicians, it's true for a lot of psychologists as well, who are more interested in solving your problems and getting you to overcome the behavior than in asking, well, okay, where does the behavior come from? And what are you still carrying inside that's making you behave that way? And how can we help you resolve what's inside you? Not just how do we help you change your behavior, but how do we help you change? Now that's what healing is. And that happens inside a person. So it's never a question of anybody curing anybody else, but we can guide people to healing if we ask the right. And by the way, when I said childhood trauma, probably some of you are at least internally shaking your heads because you're looking at your life, and I never had any trauma. Because it all depends on how you use the word trauma. And trauma, for me, and that's a whole other lecture, but trauma is not what happens to you. It's what happens inside you as a result of what happens to you. And things can happen inside you for which you don't need very dramatic events. But trauma essentially is a restriction of your capacity. It's a limitation. It's a constriction in the body. It's a constriction in your mental capacity to respond in the present moment from your authentic self. Essentially, trauma is a restriction of your authentic self in the present moment. That's what trauma is. In maybe a new way, so rather than self-judgment about stuff that went wrong or they did to themselves or others, they get curious. What made me do that? They get curious compassionately, because we were all born innocent and we were all born just wanting to be loving and loved. And then something happens. And then it's a hard road back. But I hope that this conversation helps people reconnect with that path or encourage them to continue on it. And then secondly, not to see it as an individual issue. It's a social issue. We live in a society that really does disconnect people. And so it's not just an individual problem or an individual family problem. It's multi-generational. We never even talked about the multi-generational nature of trauma, but it is. We pass this on from one generation to the next, not because we intend to, but because we can't help it. So it needs to be looked at in deep over the generations and broadly as the function of a whole society. So that the Buddha said that without the many, there cannot be the one, without the one, there cannot be the many. And he talked about the interconnected co-arising of phenomena. So we are social creatures, our brains are wired together. So whatever you're dealing with, you have to look at not just the individual internal environment, but also the broader social and cultural environment of which you're one particular manifestation. The point of compassion inquiry is precisely to drill down to those core stories that people tell themselves. Is to actually get them to see what story they're telling themselves unconsciously, what those beliefs are, where they came from, and show them, guide them to the possibility of letting go of those stories, or letting go of the hold that those stories have on them. It's simply a method of drilling down. When I say drilling, I don't mean like a dentist. Although pain can come up, but the difference between this method and the dentist is that the dentist necessarily causes pain in the course of their work, and so most often they numb people before they do their work. Well, here it's the opposite. It's not that we cause pain, but pain may emerge, and we don't want you to be numb. If the pain emerges, we want you to feel that pain. However, the assumption is that we don't have to cause it, it's already there. And very often the stories we tell ourselves are attempts to get away from the pain. I mean, I'm talking about the conscious stories, to get away from the pain or someone to manage it. And those efforts to manage the pain, not to feel it, then are the basic cause of illness. Whether physiological illness, well, all illnesses are physiological, but whether the obviously identified illnesses like autoimmune disease, neurological illness, from multiple sclerosis to chronic skin conditions, these all have unresolved and unrecognized emotional underpinnings. And in my view, those underpinnings are rooted very strongly in a person's childhood. Saying to you that just about everything, not everything, but just about everything that we call illness is rooted in compensations and adaptations that have to do with childhood trauma. The adaptations that children are forced to resort to in response to early stress help them endure that early duress and difficulty, but those same adaptations become source of pathology later on and even threaten longevity. In order to understand the basis of that, we have to consider how we look at human beings, and how we look at disease. Now, Western medicine looks at disease from a particular perspective. And you have to understand something about medicine. It's science, all right, but it's also ideology. And there's a difference between science and ideology. There's a lot of science in it, and it's great science. But there's also ideology. And ideology is a point of view. It's as the Germans say, it's a Weltanschauung. It's a worldview that you're not conscious of. That you have hidden beliefs that you don't question. And people that question the hidden beliefs are seen as outliers or mavericks. And that's an ideology. And that exists in all realms. So there's always ideological biases hidden in any system. And the logic of the system operates within those biases. Now, what are the biases of Western medicine? Well, the biases of Western medicine are, number one, that diseases have either physical causes in a sense of genes or external forces like bacteria or viruses or toxins, or we don't know what the causes are. So the causes are either physical or the disease is what we call idiopathic. We don't know what the source of it is. The second bias is that diseases happen to organs. So you have heart disease, and you have lung disease, and you have disease of the connective tissue or the liver or whatever. And then there's specialties designated to study in depth the diseases of these organs. So we separate the organ from the whole person. And then we separate the person from the environment, so that the social environment, we might acknowledge the role of the physical environment, but we certainly not acknowledge the role of the social environment. in Western medical terms, the average physician would not be able to explain to you, and this is not for lack of intelligence, simply for lack of training, would not be able to explain to you why is it that the more episodes of racism. Now, there's a condition which is increasing in the population called hypertension, which is to say high blood pressure. And for the most part, about 5% of hypertension cases are secondary. In other words, they're caused by some disease in some other organ, like the kidney, for example, or adrenal gland or something. But for the most part, we call it essential hypertension, which basically is a way of saying that we haven't got a clue what causes it. And what if I told you that the blood pressure of American black males is much higher on the average than that of whites, and they're more likely to develop hypertension, much more likely to develop hypertension? Does that give you any clue as to the source of hypertension? Maybe? As opposed to their genetic relatives in Africa who don't have high blood pressure at all? And all you have to do is say hypertension a few times, like hypertension, hypertension, hypertension. Anything spring to mind? Maybe there's too much tension in these people's lives. And of course, James Baldwin, the American black writer, famously said that to be an American black male is to live in a state of suppressed rage all the time. The first fact is a study that was done in the United States last year, or I should say 2 years ago now, that showed that the more episodes of racism an American black woman experiences, the greater her risk for asthma. Now, you can't explain that on molecular grounds. You just can't. The racism-induced asthmatic attack, we can see that, obviously, emotional factors must be playing a role here. And not just emotional factors, because the black woman who experiences racism isn't an isolated particle responding to nothing in the environment. She's affected by a social circumstance. Nor would the average physician be able to tell you very easily the multiple times documented fact that children whose parents are stressed are more likely to have asthma. As a matter of fact, the degree of the child's asthma has been correlated with the degree of mental disturbance on the part of the parent. So you go to the physician, you get the inhalers, but that's all that happens. The human beings can't be separated from their environment. And what happens inside an individual on a physiological level is very much determined, or at least affected by what happens to them on a social level. So nor would the average physician be able to explain to you, based on their training, why is it that if you look at lung cancer, the more adverse childhood experiences that you have, in other words, the more trauma you've experienced, the greater your risk of lung cancer, and this is true even if you cancel out smoking as a factor. Nor would the average physician be able to say a whole lot about the fact that a Canadian study showed that if you were abused as a child, your risk of cancer goes up by nearly 50%, and this is even after you've factored in or factored out things like smoking and drinking, which abused people are more likely to do. At the same time, human beings have always known, we've always known that things can't be separated. So there's always been this tussle, you might say, between a unitary, holistic view of human beings and existence in general, and the dualistic view that separates things. So the Buddha said 2,500 years ago, he said, look at a leaf or a raindrop. He says, and meditate. He says, meditate on all the conditions that are necessary for the existence of that leaf or raindrop. You look at a leaf, it contains the sun, the light, the photosynthesis. It contains the earth in the form of minerals, and it contains the sky in the form of the water. So the leaf literally contains earth, sun, and sky. He says, the birth of any phenomenon, he says, is dependent on the birth of other phenomena. He says, without the many, there cannot be the one. Without the one, there cannot be the many. And that was the Buddha 2,500 years ago. And wonderful writer, Susan Griffin, in her really transcendent book, The Course of Stones, wrote that The story of one life cannot be told separately from the story of other lives. Who are we? The question is not simple. What we call the self is part of a larger matrix of relationships and society. All the lives that surround us are in us. But let me give you a personal question again. If I were to become abusive towards you right now, verbally or otherwise, what would be your options right now? The rational response, if I were to become abusive, would be for you to just assert yourself, saying, don't talk to me that way. Or it would be to leave, saying, this interview is over. And if for some reason you had not the strength to do either of those, there's other people in the room here with us, you could ask for help.
Right.
But what if you couldn't escape, fight back, or seek help? Then you would shut down or tune out.
Right.
In other words, the tuning out is simply a defensive response on the part of the brain. Now put me back into my infancy, when my mother is so grief-stricken that I'm crying because she's in pain. The child is very open and can feel the pain and suffering going on in its immediate environment. The child is aware of its own body and can also feel the tension, rigidity, and pain in the body of the mother or of anyone else he's with. If the mother is suffering, the baby suffers too. The pain never gets discharged. The organism does not develop the confidence that it can regulate itself, that things will happen the way they should, hence lack of optimism. My mother didn't abuse me. She did her best to look after me, but she was stressed, depressed, terrorized, grief-stricken. I'm picking that up as a sensitive infant. Can I fight back, change the situation, or escape? None of those. What can I do? Nothing I can do. My brain will tune out as a way of dealing with the stress. So I'm not talking about abuse here. I'm just talking about stress mothering or parenting. The child's brain then will tune out. When is the child's brain tuning out? When the brain is developing. So the tuning out then becomes programmed in as the default setting. And that's why ADD. So it's not an inherited disease. It's not a disease at all. It begins as a coping mechanism, which then gets programmed into the brain. And as a lot of these early coping mechanisms function, they help you in the short term create problems in the long term. And that's ADD is one of these examples. And of course, it also makes you more prone to be addicted, because now when you tune out, life becomes less interesting. You shut down emotionally, you protect yourself. Now you feel depressed. What does depression actually mean? You said you were depressed. What does depression mean? To depress something is to push it down. What do people push down in depression? They push down their emotions. Why would they? Because the emotions are too painful. So even depression becomes as a coping mechanism. You push it down so you don't feel the pain. But then later on, that interferes with your life functioning. So it all begins as a coping mechanism, and later on becomes a source of dysfunction. And all this is happening when the brain is actually developing. So these are the links I began to make, including after I was diagnosed with it. So and then despite the fact that a couple of my kids were diagnosed, I knew that this wasn't a genetic disease, that what it is actually is a coping mechanism which got programmed into the brain. And then when I read the literature on brain development, wow, turns out that the human brain is shaped by the environment, and particularly by the adult-child relationships. And so it all began to make perfect sense to me. The most important influence shaping the physiological development of the brain is the quality of parent-child relationships. Now, when parents are stressed or distracted or workaholics, like I was a young parent, if there's instability, economic troubles, relationship troubles, unresolved trauma on the part of the parent, loving parents who are just stressed, that'll interfere with the child's brain development. That's why we're seeing so much more ADHD now, so much more autism, and so much more other problems, because of stress in society that affects the parenting environment. In other words, yes, there's physiological problems with the brain, but it's not a genetic issue. It's related to early experience. So when you look at brain scans of adults that are troubled brain scans, as you do in addicts, you're not just looking at the impact of addiction, you're also looking at the impact of childhood trauma and childhood stress. And this has been shown over and over and over and over again. So there's no separation between the physiology and the psychology. So if you come to me as an addict and you say, I got such and such, and I ask you, what does it do for you? And you say it numbs the pain, then my question is, where did you develop the pain? What happened? And then we have an inquiry. And now it no longer becomes a shameful thing that you chose this, nor does it mean that you're stuck with it because you got this genetic problem. We get it as an adaptive response to something that happened, and we can heal that. The reason why addiction treatment is failing is because physicians don't understand this. They keep dealing with the effects, which is the addiction, and the behaviors, which are the effects of the addiction, but not the cause, which is the childhood distress. And the impact of childhood distress that carry into adulthood, in other words, how we stay prisoners of childhood. And so present methods of treatment in psychiatry, in addiction medicine, in childhood psychiatry deal with effects rather than causes. And this is why we're so ineffective as. And he says, your conflicts, all the difficult things, the problematic situations in your life are not chance or haphazard. They're actually yours. They're specifically yours, designed specifically for you by a part of you that loves you more than anything else. The part of you that loves you more than anything else has created roadblocks to lead you to yourself. You're not going to go in the right direction unless there's something pricking you in the side telling you, look here, this way. That part of you loves you so much that it doesn't want you to lose the chance. It will go to extreme measures to wake you up. It will make you suffer greatly if you don't listen. What else can it do? That's its purpose. I found this to be true of physical illness and mental problems and everything. You got to see what is the teaching here. So we can look at all these things as problems to get rid of, which is what the personality wants to do, or we can look at them as learning opportunities, which is what your true self wants to do. Now, two things. One is you talked about intention. So that intention in life in general is absolutely essential. Like every morning, what is my actual intention?